in implementing palliative care units in the state of Telangana. And he's a nursing superintendent for Kumudini Devi Hospice. And he's also working with neonatal palliative care department in Nilofer Hospital, Hyderabad. Welcome, Brother Swarup. And I think this is a learning session for me also, because we always struggle with ostomy cares, and nurses always teach us really well about all this. And this is really important session because we don't get much exposure like this in many of the training programs. So welcome, Brother Swarup, and welcome all the participants for the session.
Thank you. Thank you for a warm welcome. So good afternoon, everybody. As Madam said, my name is Swarup. I hope I'm audible to everyone. If you have any
Yes.
questions, please raise your hand, or you can just message in the chat, so that at the end, we can just discuss about that. I'm going to start my sharing the screen now. Yeah. Yeah. Okay. So we're up with that right now. So before I start introducing about the stoma, we all were heard about that. Many times we see a lot of patients in our centers, where a lot of patients come up with the stoma. So what is the most important thing what we are going to learn today in palliative care, and out of which one of a main important issue, or the patients facing such problems about that, is nothing but the stoma care. So here we are going to deal about how do we deal with the stoma, and how to address those symptoms, followed by what would be the management, followed by the education to the patient and family. The place where I belong to would be the city, like we live in the city, but still as a trainer for the palliative care in the state of Telangana, I used to go out to a lot of other places. Going around, when I see a lot of villages around the state of Telangana, and these are all the remote areas where you don't have an access even to the primary healthcare centers. So it's a big challenge for us to really go through that situations, and the problems the patients are facing in. So I would like to start from that level. It is not just like a session going up and learning more about that. One day you would be the perfect person, but somewhere I wanted the family to be the perfect person. That's how the government of Telangana has taken a good initiative in training the family members in taking care of the colostomy or the stoma care. So one thing is to teach somebody, we may have to be a bit active and more oriented to that. So first, let us just learn more about what stoma and colostomy is all about, and then that will be easy for us to teach the family members and the patients too. So I'm going up with that now. So stoma management. So just think about the ostomy. Ostomy is nothing but an artificial opening. In Greek, the meaning of the word is mouth, or the mouth-like opening. So there are two types of ostomies. Number one is an input ostomy, and number two is an output ostomy. Input ostomy, you can see the tracheostomy, the opening, input opening, and gastrostomy is also an input opening, and feeding jejunostomy. Followed by the output ostomies are colostomy, urostomy, and ileostomy. There are different types of ostomies which are presenting with us. There are a few temporary ostomies, and permanent ostomies too. And there are two different types of ostomies in that, again, single and double barreled ostomies too. So the point is where we are going to touch right now. So what is that? Each and every patient, remember, not all the patients are the same, not the treatment is the same. So when you start looking into the assessment of the colostomy, you may have to be starting from being very confidential, number one. Number two, be individualized. It is not depending on one person has done this, so we are going to do the same thing to the others. It keeps on changing. So I've been experienced this kind of colostomies since last 13 years in my career in palliative care. So where I've seen a lot of different aspects, and its ratio, and the way the patient and the family is burdened with financially buying all those material and all. I'm going to show that maybe in the future, uh, followed by the ostomies. And here, so The pre-operative counseling. Here I wanted to stop for a while and tell you something more about this. There are a lot of patients in our sectors, in our state of Telangana, where we do the counseling a lot more than everything. That's what the pre-operative counseling is more all about. When you start talking to them about how the colostomy is going to be, when you don't show them what it is and how it is going to be, they'll surely be scared and they go up. They ran away from you. They go out getting all this Ayurvedic treatment or something else, and they come back with the severe problem and intestinal obstructions. And one day they may be in front of you in a situation where you can't do anything. So what I say is prevention is better than cure. As you said, it's important for them to prepare for prepare with a good counseling. So teamwork together, everyone together, come and talk to them, tell them. So that's what we do. We don't want the people to be to run away from our program, nor we are not even burdening them, but somewhere we are going to educate them in a way that it is going to be beneficial for them. For example, think about a patient who lives for a long time. Maybe if he is having a good colostomy bags which are kept in a proper place. So if that really doesn't happen, surely the patient is going to die very soon with the poor quality and a lot of fecal vomitings and intestinal obstructions, constipation, distended abdomen, a lot of other issues too. So to prevent all these things, maybe the teamwork, everyone has their own responsibility in educating and explaining the patient about what is happening, how is the future going to be. No one assumes that it is so simple. Maybe for us it is more easier. As we are the medical professionals, it is easy for us to think about ostomy in a single word. But somewhere when you talk about that in a play, people who live in the remote areas and who really doesn't have exposure of all this ostomy or the medical professionality, they'll be in a trouble to decide whether to go for that or not. Like even right now, even in during this COVID period, a lot of different institutions and different programs, you see a lot of different treatments have been given up. When one patient has been treated with the different people, they'll get confused. So somewhere they may stop one drug, or they may start on the other drugs. So it's a bit challenging to say. So be a little more empathetic and try to make the patient more comfortable. So try to convince them. Individual care is also important. So each and every individual is also very important for us. Number three, a good explanation to the patient and family. So what we try to do is, when there is a patient who is planned for the colostomy, we show them the pictures of colostomy. How does it look like? How your lifestyle is going to be changed tomorrow? When you start talking about that, on the day one itself, that will make you a lot of changes. Unless you don't talk or you don't open your mouth in palliative care, it is not going to be worthy. So only thing you have to do is educate the patient, show them, convince them, tell them the good and bad. Don't never say only the advantages, but also there will be some disadvantages, but some way you have to cope up with the situations. And the emotional support, it is very bit challenging for us. Even though after a long distance, people may say that I refuse it, I don't want it, but some way it is all a patient's choice or the patient's autonomy, I feel. But some way when you have a good explanation, surely the patient may come back for to accept that situations emotionally. Marking where the site is going to be, how this opening is going to be. So these all things has to be prepared, and prepare a patient and the family for the colostomy. So I see some disturbances with somebody, maybe. Yeah, thank you. Okay, the common problems what you see. So as I said, I'm going to add a bit of detailed information about how to identify the problems. What are the problems do the patient face when they have this kind of ostomies? As I told you, that ostomy is not a very simple thing. Stool should pass through the rectum. This is how the common process is. Once such a huge, I can say that it is one of the very important and crucial part in our life. Defecation is one of a crucial part in our life. When the main part of our life has been missing in our life, and there is a changes which has to happen, surely the bowels get into the different scheduled process. So to get into that issue, we may have to just think about all the common problems the patient may experience. Starting from the first point, I can say the excoriation of the skin. The prolonged pressure application over the site of the colostomy, you'll surely develop the excoriation. That means nothing but the skin is getting damaged. Starts with the dryness, prolonged pressure application of the colostomy bags over that skin area, and which may leads to the skin damage, and slowly you can see the redness and skin peels up, and then it will be an excoriation again. And then point two is a foul smell. It's almost common in most of our patients may experience a lot of bad smell. Stool is somewhere disgusting. It's not so comfortable for anybody to feel the smell even. And that too, it is very close to their body. And it is all open. Anytime it may smell or may leads to some inconvenience for the patient and the family members, not the society whom he is going close to. I've seen a patient with an example I would like to. There is a patient with the colostomy, and he doesn't have an excoriation, but he only have a foul smell. He's scared of coming out of his room just because of sometimes the bag may spill up. So I don't want anybody to see me with that with the faces like that, the ugly faces. It doesn't look good for him. So he refused to come out of that room itself just because of the simple thing like foul smell. So how to control that bad odor and what are the measures to be taken, we are going to learn more about that later on. So fistulas. So this is called as a stomal fistula. That is also a type of opening. And on the other side, stomas, the fistula is also one of the serious problem which leads to a lot of discomfort, causing the bacterial infections, and also it may lead to some dangerous conditions like death may even happen just because of that. It generally starts with from the GI tract, any part of the GI tract, and slowly there will be the leakage of the stool directly from that fistula itself. So this is also one of the common problems noted in the colostomies. Even though after the surgery, the patients may experience there is a local metastasis which may lead to the GI tract fistulas. So strictures of the stoma is also one of a problem, and bleeding is also been seen in a few cases, and some psychological problems are also been addressed in that. How do we assess the stoma? Look at the color of the stoma first. The opening of the stoma should be cherry red in color. When we start about talking about where exactly the colostomy site is all about. So the colostomies are of four types. Like one is a sigmoid colostomy, and transverse colostomy, and descending and ascending colostomy. So out of which the most significant and commonly used colostomies are the sigmoid colostomy, where we talk more about that, from which the color of the stoma should be cherry red in color. Number two, specifically for the bleeding, usually seen at the time of cleaning, but not all the time. Apply some pressure over that particular area, add some sucralfate powder or solution. Slowly the superficial spurting will be under control, and look for the stomal edema around the stoma, and the herniation, which is more important. The prolapse of the stoma, so which will be less than 1.5 centimeter, which is not so good. So retracted, or number two, the prolapsed colostomy. So prolapse is also a problem, and retracted colostomy is also a problem, because when there is a stool coming out from the colostomy, that should be in a proportionate area where the stool has to get collected directly into the bag, not to spill out on the skin and leads more damages, and a lot of leakages may happen through the sticky bags which were been fixed to the site. So retractions, so no interference with the bowel movement, and no interference interference, and surgical corrections is advisable for that situation. And stenosis and periostomial skin also has to be observed for. So when you talk about the skin care, so for the first time when you see a patient with the colostomy, what are the basic, very important essentials what we are going to teach to them is start with the wash with the soap and water. Number one, clean it well. So in my experience, I have seen when I've been to Canada 2 years ago, I was looking for a lot of such colostomy patients. So at last I have got 2 to 3 patients who are with the colostomy, but nowhere I see them developing like a, look at this slide. Nowhere I see such common problems from that patients. It is all no excoriations are being seen, no other any kind of techniques which are implemented for the excoriation, nowhere else. But in India, in my places, I see a lot of patients were in need of care of excoriation, care of smell, a lot of things like that. So what I would like to say that is the people in our places are a bit illiterate, and they don't know really to take care. Like they are from a very below poverty level. They don't know what it is all about. And the day one during the surgery itself, the team should start speaking to them about what kind of care to be provided at home and how it is going to be. and what it is all about. When you start talking about that, only that particular time is going to bring a big change. So including the medication usage in our hospital, we do the same. Teaching them, a lot of teaching to the family and the patient makes a lot of possible changes in our daily activities. As the same, washing up with the soap and water is a first priority. Number two, clean it well and make it dry. So it should not be moist all the time. The correct size bags should be kept. I'm sorry that I could not present any of my bags, or in probably to say I used to uh, provide some demonstration techniques for you too. But this time, as uh, I'm quarantined, I could not come back with any of my practical exposure. I'm sorry about that. I'm going to just show you some slides of this. That's it. So the correct size bags, like maybe the bags I'm going to show you later, and correct size bag should be there. The bag should not be too heavy, nor it should not be too small. The opening should not be too small. It should be in a correct proportion where the stool should get directly come in contact into the bag, so that there will be no leakage. And remember one thing, empty the bag when that is 3/4 full. When that is 3/4 full, you may have to empty the bag, because the weight which have a lot of burden on that, the stickiness may come down soon, and you may have to change the bags more frequently, and it is more expensive too. And soft cotton material to clean that areas. So use a very soft cotton material to clean that particular area. Try to avoid some powders or creams on that particular area. Powders and creams makes it most moist, nor the powders makes a lot of crackings in that particular area, which may also leads to excoriation. So if there is any fungal infections, you can go up for the fungal powders. And as we discussed earlier, there is a skin excoriation. So for that skin excoriation, what would be the correct management? I have a product named Karaya powder with the egg white application. I'm going to demonstrate, or I'll just show you how to do that in the next slides. So Karaya powder, it is a extract from one of a plant named gum acacia, combined with the egg white application. So when these two together forms a paste material where it gets sticks to that particular area and helps in preventing the skin excoriation. I'm going to show that to you. So the bags which are available for us in India, maybe most probably in all the parts of the South India we have, or this bag number is 17501. That's a code number for this. So when you order or place an order for this, you may have to say 17501. So this is a bag. Just have a look at the left side of the screen. You have a small transparent layer here, which is a plastic sheet. So it can be peeled off from the red origin here. You can just remove that, and this can be stick directly to this. On the left right hand side, you can see the centimeters, the circumference 75 mm. From there, based on the size of the colostomy, you may have to cut it into the circumference here and peel off this red marking. From the red marking, open it up and apply it directly. And from here, you can fold 1 to 3 layers and clamp it well. So the stool which is collected into that will not be leaked, and you have a correct sized bag where you are going to measure it first, placing any paper over the colostomy site, and get some markings to be done here. So for example, there is a marking out here. That means the proportionate or size of the colostomy bag is perfect. So when the stool is collected directly into this, the stool directly comes in contact into the bag, but not on the skin areas which is exposed. So stool will be corrected directly, so that will be more easier. Once it is filled, 3/4 filled, you may have to just open the locking system here. So the stool will be collected directly down, and you can just wash it and leave it up like that. So one benefit I see in this kind of, we have few disadvantages and advantages in that too. Somewhere when you talk about the advantages, the color of the beauty of the bag is much better because it is not transparent. So stool is something which everyone feels disgusting, and they don't like to see that even. So, and into the society, when you talk about people or the family and neighbors looking into that, looks very uneasy. So somewhere it is trying to control the color of the stool at least, but it doesn't have any other options more than that. But somewhere the disadvantages I see, it is a sticky bag. Sticky bag, a lot of excoriations may happen again. Slowly the patients may develop a lot of skin excoriations, and you may have to take care of the skin conditions again. Here you can see these are called as a reusable bags. and the transparent sticky bags. We have two different types of bags that have been exposed here. On the left hand side of your screen, you can have a look at the bag. This is from the Ostomy India, a company from Bangalore, where they provide a lot of good quality bags. And this is a plastic bag, which have a good plastic to say. And these are not the advantages. I'll talk about the advantages first. The advantage is it has a belt system. So you may have to fix this belt directly over that buckles, and you may have to fix it directly. So the stool will get directly contact into this area. Just have a concentrate on my arrow mark here. So the stool will be collected in here and falls in directly. But somewhere the small disadvantage I see is there is no locking system anywhere in the top lower end. So only thing is you may have to put a clamp or rubber band more harder and tight so that it will not be open. The main point of they haven't put the clamp for this, like when I spoke to them about that, is it is just because of they want this to live long, like it can be worked for 6 months. Let's go back to the slide. Talk about this. This bag is around some 200 and 250 rupees in Hyderabad. So people may have to purchase. As we work from one of a government hospital, we also been linked up with the government regional cancer center, where we have bags provided, only 2 bags per patient per month, which is more expensive. So one bag may be useful for maybe a 5 to 6 days, not more than that. So how about the remaining days then? So for 2 weeks, the patient would be provided with the bags. But what about the rest of the time? That's what is bothering us. So at this time, we thought it is more helpful and more comfortable providing bags for cheaper prices. A bag, 2 bags, and 1 belt costs around some 150 rupees, which is more easier and cheaper. They have to wash it again, reuse it, wash, reuse it. So for 6 months, the patients would be more and more comfortable, need not spend a lot of money going around getting it available. And also ostomy bags are a bit hard to available. Like we see a lot of patients coming up from the different places. And also people are not so exposed and experienced about this. So they charge a lot. Like one single town having 1 or 2 private marketing persons who come home and do that. For doing that procedure itself, they are charging a lot of money. So just think about that. This is all very expensive procedures. So let us learn well and teach the family so that they'll not depend on anyone. On the other side, we have a transparent and sticky bags. This is a sticky bag, very transparent, very delicate plastic you can see, but there is a locking system here. But this can be used for a day or 2 days, not more than that. Once it is heavy or it gets disconnected very soon. So that is one type of bag. This is also one of different types of bags available here, which has, you can see no stool can be visible here, and it has a very good clamping system, and it is a sticky bag. Based on the size of your colostomy, you may have to cut it and stick it to the body. It remains for next 5 to 8, 7 days, and then it can be thrown out again. You may have to change the bag again. So how about the colostomy, care of the colostomy? What type of care should be provided? As we see that is a cherry red in color, and just check for the surroundings of the colostomy, how it is been presented. Somebody can mute your phones, please. When you're not talking, please try to mute your phones. Thank you. Okay, so have a look at this picture. You can see the surrounding skin. I can say that is the film layer of prolonged pressure application over the colostomy site. You see the colostomy, the opening, the mouth type of mouth-like opening is somewhere over here, and this is cherry red in color. But somewhere on the other side, I see the patient is prone to develop the skin excoriations. The skin may get damaged very soon when there is a prolonged application of the colostomy bags. So what kind of care has to be provided? The nursing issues in this situations are patients may have irregular bowel actions. Like I started with the same point using, there will be irregular bowel actions because of the bowels are not been used to that situation. So each and everyone have their own habits of defecating. You know, one goes out every day, one be in a fixed time. It's all dependence on their own individual activities. So when there is a change in the habits, nor the bowel actions are being changed just because of the change in their body. So you have to be a bit cautious about that. Irregular bowel actions Number two, sometimes the patients may become constipated even through that. And maybe the intestinal obstructions would also be the cause of this. So when there is constipation, you may have to look into that and try to introduce a little finger into the colostomy, see for any hard obstructions or the mass nor the stool. If you find something like that, use some suppositories, enema, nor laxatives to clear up that. So diarrhea is not more common in there. So increase intake of fluid and hospitalize as early as possible whenever you see such diarrhea. Flatulence is also one of the major nursing issues we have identified in our patients. So try to just at least identify the problem nor the issue and try to deal with that. So unless you don't talk about that, people doesn't come forward telling you all the aspects of the happenings in their life. So somewhere we may have to be a bit more aggressive or talk more about this and explain to the family members. Yeah, how about the diet then? Dietary, which plays a major role, and patients and families might have a lot of worries or the questions, queries about what do I eat? If I eat a lot, there will be a gases produced, or my stomach may become distended. I'm taking a hard meal every day. So if I take a hard meal, and I'm going to get constipated with that. So there are a lot of questions, such things like that in the society we experience every day. So try to start talking about what do they eat regularly? What do they eat? If they are sticked up to what kind of foods, what they use it regularly, try to not to avoid those foods. Eat regularly, do not skip the meal. That's the first thing. Empty bowel producing gases. Number two, so when adding some new foods to the diet again, you may have to be a bit cautious about adding some other foods to that. Point number three, the food which is given should be very small. Number two, frequent meals are best. Before eating that, chew thoroughly, and the small foods and semi-solid foods would be more adjustable than the foods what they eat in the regular activities. Limits food which containing simple sugars, which may aggravate the diarrhea. So be cautious about that. Spicy food should be completely avoided, and maybe for a period of time till the habituation comes. And the high fiber diet can also be provided, and 6 to 8 glasses of water each day, but not with the meal. Maybe before and after the meal can be suggestible. So management of this excoriation. So have a look at the picture on the right hand side of the screen. Just follow my arrow mark here. So there was this patient was operated very well long time ago, and slowly after a few days or months, she developed the dry skin around that particular colostomy site, and it became more worse day by day, and it is causing a lot of pain. And the question is, she could not put the sticky bags anymore. The cause of that is when there is a lot of excoriation around that particular area, which is making her more uncomfortable, lot of pain, and could not stick the bags directly over that area. So what is that we are going to do in this situation is, so using a curry powder and an egg white. As I told you that gum acacia is derived from the gum acacia curry powder. It is a extract from the plant, the powder, and the egg white. So we are not taking any yellow part of the egg, only the egg white and the curry powder. Stir it well, mix it well so that the crystal should not be there, and make it as a paste. Take that pasted form. Just follow my arrow mark here. That will be more comfortable for you. Paste the total cream. So as those two are in a gelatin form, somewhere after some time, when you stir it well, it becomes a paste. So the whole paste can be applied over this particular area. Over this, I would like to cut an opening of the colostomy there in that particular area, and put a plastic sheet over that side. I'm going to take a polythene sheet, a plastic sheet fixed up here, cut it in this opening. So let this opening be there, but the skin excoriation site, I'm going to close it with the polythene sheet here. So pressure application is more important. Apply some pressure for 1 to 2 minutes. Wait for a while, and then that particular area is stick to the skin. It gets sticks to that particular area, and it becomes dry and becomes hard. So now it is in contact with the skin directly. So 3 layers you can see here. Number 1 is a skin excoriation layer, followed by number 2 is the curry powder and the egg white together. Curry powder helps in healing process, and egg white helps in binding a layer in direct contact of the colostomy bags to the skin. So it acts as a binding layer and also helps in healing process. So this is how it goes on. And over that polythene sheet, I'm going to apply the colostomy bags here. So there is no direct application of colostomy bags. Over that, there are multi-layers. One is a polythene sheet. Number two is the egg white and carrier powder. Behind that is the excoriated part of the skin. So I'm going to fix it here and leave it like that. So once I leave it like that, it can be used for, the bag can be used for 3 days. Once it is filled, you can just 3/4 full, you can just remove that. And if it is heavy, just be cautious, because we are just directly depending on the stickiness of the bag, that's all. So once it is full, try to just evacuate it as soon as possible. On the 3rd day, you may have to put some water again, so it becomes a gelatin again. Like earlier it was, when these two are in different forms before the combination, those two are in a gelatin and a powder form. So it comes back to the same manner again when you add some water to that. Clean it well with the dry and soft cotton cloth and make it dry, and apply the carrier powder again. So you may have to take a pictures before and after. So day 1, when you are applying, take a picture. After 3 days, look for the changes. So we have a lot of such experiences in our hospital. We can take a pictures which gives you a lot of information. I'm sorry that I could not share any of those pictures right now. So that's how we apply this carrier powder. So 2 to 3 attempts of this carrier powder and egg white together over that area can control this skin excoriations. So further on, maybe if there is a need of putting the bags, just think about once or twice. Either the sticky bags are going to help them, nor using a reusable bags are more comfortable for them. Just give information so that the family can also be more exposed. So this is the address of this carrier powder, Ostomy, India, located in the city of Bangalore. A brief information about that. So followed by the colonic irrigation. So before that, I would like to add some more points to that. So I haven't have a slide here, but somewhere I see a lot of patients with a huge belly, and foldings are seen over the both sides of the abdomen. So in the lumbar side, there will be a lot of foldings up here. So when there is a foldings on the others, both sides, either sides of the colostomy, there will surely be a leakage, and the sticky bags which are fixed or any kind of bags will not be the correct sized bags, or there is nothing we can do. So we also have from the Ostomy India, we also have a Coloplast ointment. So ointment, it has to be applied over the surrounding area of this site, and then stick a bag directly to that. Apply pressure again for 2 to 3 minutes. So this paste which is applied becomes hard potential form, and it sticks directly, binds as a bridging layer, so that there will be no leakage from the either sides of the colostomy during the at the folding sides. So there will be no leakage, and it sticks well, and the bag will be placed in a proper way. And that ointment is also skin friendly. It doesn't damage the skin at all. So that's a good sign, I can say, when there is a foldings I would like to add. And about the colonic irrigation, this is one of the best part of for me in the session. So number one, colonic irrigation is nothing but establishing a regular bowel habit. It maintains a very good bowel habits. Number two, cleans the colon of gas, mucus, and feces. Number three, prevents a skin excoriation. To see that, it may look very simpler like the other bags, but somewhere when you talk about that, it is more easy for us to administer. Fixing of a bag to that body, that's all we can do. But somewhere I'm more concentrated on aftercare of this. Anyway, during the surgery, even the tracheostomy, the colostomy, urinary catheter, whatever the surgery, the patients would be more fine and comfortable for next few days or the months. But somewhere followed that, they are going to be into a lot of infections. So to prevent that, or the complications, or whatever the issues which will be arrived from. So establishing a regular bowel habit with the colonic irrigation is possible. It cleanses the colon of the gas, mucus, and feces. Skin excoriation is also been removed. Skin excoriations will not be there, and it also removes food ingested by the patient. So once the habit is formed, it has to be done in an alternative. I'm going to show you how that is going to be. So irrigation need to be continued for the lifelong. That means this irrigation can be only helpful for the permanent colostomies. Number two, habit formation can only happen only after 21 days of the surgery. So, sorry, not the surgery. Maybe it may take, once you start doing this colostomy, colonic irrigation, it may take at least 21 days for you to get adjusted to that. Like earlier, there was an issue in our slide written that irregular bowel habits. So bowels has to be used to that. It is called nothing but the bowel training. So when you start training the bowels in a fixed time, that's how we do even in a patients who are bedridden. They're bedbound completely and they become constipated. To prevent that constipation, instead of going up for the laxatives, we do a good bowel movements, manual evacuation, rectal massages in a fixed time. So as the same, the habit formation may take 21 days for a patient to get adjusted to that. So irrigate daily at a fixed time, not in irregular times. Fixed time irrigation should be done in a proper way. So have a look at this bags. So this is a bag with 1.5 liter of mineral water placed in with the regulator and the funnel over here. Have a look at this. This funnel, yeah, this is one part, and this is another drain bag, we call it as. You can see an opening here. There are double layers of, here is also an opening, and the end there is an opening. That means just like a pant, we have a hole on the inner aspect of the thigh. On the other side, it is all open there. It is closed with that particular area. And here is an opening where the funnel is introduced directly into this. So first thing is step one, the patient has to go up to the washroom. I'll show you the picture how it is goes on. Okay, the one has to go up to the washroom, put a drain bag, like drain bag. This is a drain bag, plastic drain bag, which the stool can be collected into the bucket or somewhere. So the stool will be collected in so that it will be clean. So once you fix this bag up here, and there will be, see, look at this funnel. This funnel is going to directly go from the top end of the of this two layers and entering into the colostomy. This top end, this is going to enter into the colostomy. So once it enters into the colostomy, slowly, do not reinsert or force it, introduce it directly. So very gently you may have to do that. So introduce this directly into this and elevate or extend the end of the bag. Somewhere 1.5 liter of mineral water, drinking water can be placed in with the regulator here. Remove the clamp so that the water with the gravity goes up into the intestine, cleans up the intestine, and then this funnel can be removed after emptying this bag. Once the bag is emptied, 1.5 liter water entered in, you may have to take this funnel up from this and leave it open like that for next few minutes. And slowly the bowels will be cleared and the whole stool will be collected into the drain bag, collected into the bucket. So once the stool is collected in that, he doesn't really require any other colostomy bags anymore. As I told you earlier, the colostomy bags are something more important and crucial in our life because stool may spill anytime, it may spit, and it may make a lot of nuisances created, and we may feel more guilty. So to prevent all these things, even including the skin excoriation, the gases or the feces, whatever it is, everything have a very good solution with the irrigation bag. Number one, you may have to do it in a proper way. It may take at least 21 days for you to get adjusted to that, and leave the drain bag open for next to 30 minutes. So whole procedure takes at least 25 to 30 minutes if you are used to that. So there is a patient in 2018 when I started my career in Hyderabad. That was my first year. I just learned about this irrigation bags a long time ago. And I have gone for the home care. I have seen a patient with really in need of this because he's developing a lot of skin excoriations, a lot of troubles up to. So when I tried it for the first time, you have to believe that the patient survived for next 2 to 3 years with these kind of bags. So he used to come every 6 months to us, purchase the bag, which costs around some 700 to 800 rupees, and go back. So one bag may useful for 6 months. So the good thing is he doesn't need any sticky bags, nor he is going up in the society. He doesn't need to put the bags because I'm sure that it is not under control. But when your bowels are used to such situations, you need not have to hang around with those bags all the time. In and out. So when you're carrying or going out, whatever it is. So that's a good beneficial thing. Solutions used here is a plain water, sometimes the normal saline water, like soap water, enema, and sometimes it is preferable, not all the time. Normally we use a plain water or the normal saline. Instructions, be careful with is start irrigation 3 months after the surgery, not just after the surgery. So just look into the temporary or the permanent colostomies, and do not irrigate if there is diarrhea, which may leads to more problems again, a lot of dehydration. So do not irrigate the ileostomy. Remember that. Do not irrigate more than once a day. So it has to be in a fixed time, like I said before, and it has to be done only once daily. Use 1 to 1.5 liters of a mineral water or a drinking water, and lubricate the funnel well. Like funnel is nothing but, this is the funnel, lubricated well with the lignocaine jelly. So as the skin layers extending towards that colostomy is very smooth, so you may have to be very gentle, or you may see one of a complication like bleeding again. To prevent that, you may have to lubricate it well. Do not forcefully introduce the funnel into the colostomy. Clamp and remove the tube from the stoma after running the fluid in. Once the fluid is entered into the body, intestine, lumen, you may have to take out the uh, lumen of the funnel of this. So once it enters into that, it takes at least some 30 to 45 minutes for the whole stool to get collected into this. Once the stool is collected, other than few situations where there is a food poisoning or the diarrhea, unless the stool will be collected again when you're using it in a routine form once in a day. When you're doing it in a correct intervals, like 10 o'clock in the morning, start doing it every day at 10 o'clock in the morning. And slowly, maybe after some 20 to 25 days, you can do it alternated, like in the area sites we saw. That is a more beneficial idea. But somewhere, there will be a question for them that, what if the stool comes again in the meanwhile? So this is where we have to have a clarity that once your large bowels are emptied and it is a habitual formation, you do not worry about that. Stool will not come again and again. There will be no leakage. And you do not worry about when the stool may come up and contaminate all your clothes and expose it to all the people, and you feel guilty about that. Need not worry about that, because you are making your bowels habitual. Your bowels have been habitual in a proper manner. So remember that point, and it is going to be helpful. So seek for help when there is a continuous blood oozing from the colostomy. That means that there would be the intestinal obstructions or the tumors, which may leads to the damage, and the blood is oozing from that particular area. You may have to seek for the help further by the physician. When there is a prolapse or retraction hernia, you may have to be a bit cautious about what kind of bags to be used, how to care of that. So retraction and hernia is one of a complicated process of this. So when there is a colic pain lasting for more than 6 hours, you may have to seek for help and to start on some medications. It would be a partial or complete obstructions above the colostomy. So you may have to look into what would be the cause of the colic pain. So when there is diarrhea, dehydration, or constipation and abdominal distension, come back for the medical help, and it will be more easier. And ileostomy not working for more than 24 hours, you may have to be take for help of the professionals, and any peristomal skin problems also has to be observed for. Overall, I would like to say that the supportive care. So you may have to look into the colostomy even in the spirituality, physical, psychosocial aspects. So when you talk about all these aspects, so it doesn't mean that it is just a procedure and procedure is done and the patient may go home. So a lot of social stigmas happening. Why am I living with this? Is there any point of me living in such situations? This is what we may have to think about ourselves before teaching to the family. So that's what, since my first minute, I started talking about that, having a good communication and maintaining a good empathy with the patient and the family. What is the point of me being alive in this? What is this stool coming out from here? None of them like to have those kind of stomal fistulas, which is one of a serious problem. I have seen a young boy wanted to die just because of he doesn't like to see the stool coming out from his GI tract. There is a lot of leakages, multiple fistulas happening in his abdomen, and there is a stool coming out not from the colostomy. It's very disgusting and very bad smell, a lot of discomfort, very uneasy. Patient, that young boy could not even take food properly just because of that. See, when you talk about the quality care in palliative care, what are we going to do? What are we going to provide to that patient is all important. Don't never just look about the cure and good things happening, but whatever is existing in their life, are we going to make them the real days in their life, nor is the patient suffering? Providing the good quality and the dignity is more important, as we know that a lot of such patients may die just because of a lot of such complications and uneasy, a guilty feeling, unable to go around in the society. So you may have to think about each and every individual in a way that we are going to help him in a spiritual way, physically, social, and psychological aspect. So that's the reason why we call it as a holistic and total care. There are a few phases of the ostomy. Patients may become shocked in shocking phase and the panic phase, where it is all new for them. They don't know that how long they are going to live with that. They can't really have the sexual attitude towards his wife or the husband, whatever it is, towards their mates. But somewhere we may have to think about it. So these are the things which are not even spoken of directly, but somewhere when you have a good communication with the patient and the family members, only then they resolve this kind of things. And also the second phase would be defense, retreat, or denial. They don't accept this. None of us have that kind of blank areas where we don't refuse that situations. So it should be acknowledged all the time. We have to adapt up to that situations, or the resolution has to be seen. So physically, there are a few other things I would like to note down here. Number one is about the skin care. Take care of a good skin care so that there will be no further damages of the skin. Once there is a damage, you can't go for any kind of bags in the further. So to prevent that, skincare is most prominential and crucial part in this. Managing the leakages, bad odor, gas, pain, and fatigue is more important. Clothing changes. So frequent clothing changes. It also somewhere I see that it may look very easy for us, but a lot of our patients who are from the remote areas, they don't know. Once we go home and see them, we know that situation. A very small build house, a single room where there are nearly 5 members sleeping together with the patient. So somewhere just think about it, how hard it is going to be for the family members or the patient to change their clothing and maintenance even. So think about that. Based on the background only, we have to say, not about the technology what we have. Maybe in our hospital setups, I hope that you'll have everything available, but once they go home, the whole pattern will be changed. Just have it in mind. So based on the priority, based on their background, only then we have to set up everything. It is not just an individual to individual talking more about what it is. So sleeping disturbances. Will I be able to sleep in the either sides, either supine and the prone position? So which would be the comfortable position for me? If I lie down prone, what is it going to be? If I lie down in the sideline position, how is it going to be? Maybe try to solve those problems. Nutrition and exercises plays a major role in that. Lifestyle adaptation and the changes also plays an important role. Number two is the psychological problems. A lot of our patients may feel that no point of me healing in this stage, like depression, anxiety, uncertainty, and privacy. So fear of recurrence. It may. Do you think this disease may spread again? Am I prone for this infections again? Am I going to go back to my normal level, or coming back to the same? So negativity, like negative thinking, isolation from the family, or self-isolation can also happen in there. Preparation for the emergencies. So social travel, how do they travel in their workplaces? Social and public obligations also has to be observed. Stigma, intimacy, and sexuality, like earlier we discussed. Caregivers and partner relationship and financial management also should be addressed well. Acknowledging, like earlier we have seen, searching and applying for the meaning and faith. So all those things can be done not just because by the single individual, neither the nurse or the doctor, but it needs a total care, and everyone has to participate in caring of them. So a small point here is we also have an opening here with the tracheostomy care. Tracheostomy is a type of an opening again, like we have seen the input ostomy. So lock open, we have an inner cannula and outer cannula. Outer cannula will not be removed. The inner cannula can be removed and cleaned well with the obturator. And so placing a good padding over this particular area helps. I'm just adding this slide just because of to show you that skin excretion can also be controlled. Day one, when the colostomy or the tracheostomy is done, it looks very fine and comfortable. Maybe after a week, due to poor health education to the family, they start touching this area directly. Sometimes I see some of our patients just taking out the outer cannula even. So once it is get blocked, there is nothing we can do. A lot of infections we are going to introduce directly into the lungs. So lungs are the organs where you have to be very careful about. And once the introduction of the infections into this, lifelong the patient has to suffer. To prevent that, we may have to start talking to them. A very good explanation about how to take care of the skin of the surroundings plays a major role. So for this, I would also like to add a fine threading, a soft silky thread around this, hygiene maintenance, the inner cannula care, inner cannula which can be removed and cleaned with a betadine solution and the running water, place it back. So care of the excoriation with the same carrier powder and egg white, we mix it and paste it together. So the excoriation comes down in 1, 2, 3 setups. Patient double education, since first slide I'm going to, I started with the same education of the patient and family, and securing the site is the priority. The take home message is number one, acceptance of the stoma is more important, social interaction, self-care efficacy, adjustment in the social interactions and interpersonal relationships. That's it. Okay, so I'm up with my session. I'm going to stop this sharing. Any questions, please go forward.
Thank you, Swarup, for the wonderful presentation. Because
Thank you, ma'am.
as you said in the introduction, it's a mix of so many issues that patients face, with starting from buying the colostomy bag and having stools carrying around on your body. Even we cannot imagine ourselves carrying stools over the tummy. And very often our patients come with a colostomy bag as a surprise. They get into the surgery. Once they are out, they see something outside and the doctor is telling, yes, we had to do this. So they are not really prepared to have this situation also. And any questions from the participants? It's a very important topic, and as he was mentioning multiple times, you can really change someone's life when you start doing this colostomy irrigation, and at least to keep the bag clean, how to maintain it at home, and a lot of motivation is also needed for the patient as well as the family, because sometimes the family is very reluctant to touch or take care of these issues.
And it is
I expect
expensive
some of
too.
the, yeah,
Yeah,
exactly.
and it is expensive for somebody to come and do that. It is all a big problem. Like in Andhra Pradesh, we have another center in Karnool where there is a patient. That's my first visit. Like all of our nurses are trained in palliative care and they went there. So there is a person carrying all these colostomy bags came in and doing all these things. It was a surprise for me. We have a people here and experienced nurses in here, but still people are depending on them, and their financial background is very poor. They're borrowing money from somebody, getting up and giving some 1500 rupees to put the back, and that person left, which is very horrible. So I see the same thing happening all over in India. Like a lot of remote places, we have people there. Maybe a lot of education from, maybe from your side, it is going to go show you a good path, I think so. So thank you, man.
Any questions from the participants? I thought there will be a lot of questions.
Yeah.
Did you understand how the irrigation is to be done, the parts of it? I'm sure you may have to see the exact set to understand it in a better way, but the picture was kind of clear how how to do that. So there is a question in the chat. Can they do any exercise with the colostomy pouch?
Yeah, the basics exercise, like the breathing techniques, putting some pressure over your abdomen, it just makes your abdomen to pass the stool more frequently without preventing the constipation. So very gentle pressure application over that particular site, and abdominal massages are going to help it more in relieving that constipation. Most probably we do that in the same, make it a habitual form. So putting some little amount of pressure over the abdomen with the deep breathing exercise, pressing in so that the belly comes up, and press in with a deep coughing out. That's it.
Is that clear? Or was the question about can they do any exercise with the colostomy pouch? If someone wants to do exercises, can they do it with the colostomy?
Yeah, so it's all routine, like I say, like if they are being used to that. So even I have a few patients who do their own regular activities. Only thing we say is do not lift heavy weights, so which may also leads to the hernia again. So you have to be cautious about that. Very gentle exercises also can be done in that. That's it.
So suppose you get a patient who had colostomy years back, not done any irrigation. What is your experience with that? Do they get accustomed to the irrigation within three
Yeah,
weeks or?
it's a good question, ma'am. Yeah. Now there is a patient with the colostomy, and he was searching for the colostomy bags, which is very hard for them to buy. He traveled more than 300 kilometers away from the state of Telangana, from Andhra Pradesh, to come here and requesting 2 bags for us. So we admitted him in the hospital in our palliative care unit in Kumudini Devi, and somewhere it took at least 10 days for him to get adjusted to that, because he is all alone. Mother, father left him, no kids, everyone left him just because of the cancer and the colostomy, and he's all alone now. So he doesn't have even money. Some way we explained him about the irrigation bag, we explained and we taught him, and we made a routine in his life where now he is more comfortable. We provided 2 bags for him for the free of cost. Now he is working up with that. He really not using any kind of other bags, sticky bags too. It makes a lot of changes in that. It is.
Any other questions regarding irrigation? How to do, uh, where to hang the bag? Those are the usual questions that we get. Anyone? I hope everything is clear for you, so you're ready to start colostomy irrigation. As Swarup was mentioning, we had one patient came to me uh, with a religious issue with this colostomy bag, because he works in a temple and he never wanted to go to the temple back because he feels that he's dirty. So then I asked, it is okay because it's because of your illness and we can. So I tried to talk to him. Then he told, no, I feel unclean to get into a temple. So that was his greatest issue. His cancer was like in a stage 1, not really a very bad prognosis. So he had to be admitted, and then we taught him to irrigate, and then he started going back to the temple again, and that was a huge relief for him and his family.
Yeah, that's a good sign for them. For
Yeah.
such patients it is. So we can really, every one of us who have joined here can make a difference. Might not be for all the patients, but at least one patient, if you bring up a change, really that is going to be exposed to everyone. Yeah.
There is a question in the chat. Can he take any position while sleeping? Is there any contraindications when they have a colostomy bag?
So is that about the colostomy bag? Somewhere only I feel that when there is a lot of pressure applied over that, it gets leaked. Unless there is no other such any left lying positions is more comfortable. But somewhere the bag has to be cared well. That's it I can say. So once before you go to sleep, empty the bag well. So just see, look into the last evacuation time, and then it may take at least 5 to 6 hours for you to for the stool get collected into the colostomy bag. So for the rest of time, you'll be more comfortable in that sideline positions itself. There is another question I see.
Yeah, how often
How
irrigation
often
is
irrigation is done? So starting from the 21st day, like first 21 days, you may have to do it regularly, followed by every alternate day. Like I told you, even in the constipation patients who are bedbound, we do the same kind of bowel habits. So every alternate day, you can choose the irrigation. So getting used to that, once you are getting used to that irrigation, it means that the bowels are in his hands. So you have a good control of the bowels in that. Yeah.
Uh,
I hope you got
you
this.
mentioned it during the presentation, but what is the expense of this whole irrigation set? And
It costs
you,
around 750 rupees, madam.
you
Yeah.
can be used for 6 months probably.
Exactly. So it has a good transparent plastic where it lives long, it lasts long. So you can just wash it once you empty that, wash it well, keep it in the dry heat method. So it's all clear. So the other day morning you have to use it and pack it well and maintain it safe. That's it. So it makes a lot of changes. You're just spending some 700 to 800 rupees for next rest of the 6 months, and you don't see expiration. No other such complications are raised from that. So I thought it is more helpful.
Any other questions from your side, or should we move on to the presentation for today? Or do you people see a lot of colostomy, or you don't in your setting? You can mention it in the chat. It's done for permanent colostomy only irrigation. I did not understand the question, Jesse.
Yeah. So it is, it's done for the permanent colostomy irrigation. Yeah, that's what. See, the temporary colostomy is maybe for a period of time you may have to put it on, like double barrel. You see the single barrel or the loop colostomies. So for a time being, you can use it. So we need not worry more about the temporary colostomies at all, because for a time being, like for 3 months till the surgery, that has been there will be an opening, and then slowly they'll just stitch it off, and the patient may need not have a bag again after the surgery. So permanent is something when there is a complete intestinal obstruction and the patient's condition has been improved, and if they need a colostomy, we go for this permanent. Only then you may have to have irrigation, unless you can go for the sticky bags or the reusable bags earlier we have seen. So to prevent a lot of stickiness, instead of using the sticky bags, you can go for changing the bags with the belt again and again, which makes some sense, I feel.
How much height should we hang? Yeah.
In the bag? Okay, somewhere 6 feet above your sitting level, maybe 3 to 4 feet above from your sitting level. So when you're sitting on a chair, somewhere on the top of this level, 5.5 to 6 feet height. So that the whole water which you have fixed in the bag should drain in well, so that the irrigation can happen very well. So it has to be somewhere on the top end. That's it.
How do we clean the sticky colostomy bag regularly?
Just a minute. For sticky bags, how do we clean it regularly? Sticky bags, take out the bag, leave it open for a while. Use some soft cotton material, number one. Number two, soap water is more plenty enough to clean up the colostomy bags. Nor, if you see any kind of skin getting damaged over that particular area, add some coconut oil or any kind of lubricants or the moistures for a while, and then leave it open. So only thing is, once you relieve the pressure from that particular site, you'll surely see a big change. It's not a big deal at all. So just leave it for a while. Many are just worried about, once the bag is open, they clean it and fix the bag again without giving any gap at all. So just leave it like that for half an hour. Just open, clean it up, and have a good ventilation to that. So the damaged skin will recover again. So it is nothing about a type of a pressure ulcer, I can say. So prolonged pressure application may leads to the source. That's it.
Thank you so much for your responses. Arun, can we start the presentation for today?
Yes, ma'am. We can start. Today we have a case presentation on ostomy care that will be presented by Sister Lachen Chui.
Yes,
Sister,
sir.
are you here? Okay.
Yes. Hi, everyone. Hello.
Sister, can you speak loudly? Your voice is not audible.
Hello, everyone. My name is Vila Chantai, and I'm a staff nurse in Mukunda Christian Repression General Hospital. Let me go direct to my patient details. My patient is 46 years, gender female, and he was diagnosed with adenocarcinoma of rectum, also called colorectal cancer. Presenting complaints. First is leakage of juices through the filter. That make all his clothing and bathrobe wet, and this make my patient very embarrassing. Number two is intermittent but weekly episode of severe abdominal pain. The pain is mostly in the left iliac fossa, and then the pain usually lasts for several hours and resolves continuously. Number three is difficulty getting pouching system on due to growth of tissue on the stoma. Wife is assisting here in changing the stoma bag. History of illness: diarrhea since 6 weeks and intermittent fresh rectal bleeding about a month. and he was diagnosed with deep B adenocarcinoma of rectum and abdominoperineal resection and formation of permanent ankylostommy was performed. And then my patient undergo radiation therapy and chemotherapy after all this surgery. On examination, abdomen was viewed, bone spots on Y laterally, and his abdominal contour were uneven. Left side is higher than right, and large ulcer seen above his stoma. Large growth of granuloma type tissue present across stoma. Granuloma tissue is a new connective tissue and microscopic blood vessels that form on the surface of wound. Treatment and significant investigation. Number one is colostomy. For my patient, this colostomy is done for his rectal bleeding and for the complaint of diarrhea and biopsy of stomal tissue. This was done because granuloma type tissue was present on the stoma, and ECG and X-ray was done as usual. Psychosocial aspect. Patient is married, wife is 38 years old, one son and one daughter, son work as police, daughter still studying, and they are from Hindu background, and he's a farmer, wife is a homemaker, and their source of hope is from his family, especially his son, and they also financially dependent on his son. These present medication are paracetamol of analgesic and loperamide to decrease the frequency of diarrhea that this present complaint, pantoprazole to reduce volume, gastric secretion, and stomal volume, and zinc oxide paste to reduce skin irritation. Main concern, like self-care concern, body image concern, self-esteem concern, relationship concern was the main problem of my patient. As studies show, 15 to 20% of patients experience negative psychological symptoms after stoma. My patient also experienced most of these feelings, and for his self-care concern, he was feeling guilt or embarrassed that his wife always needs to assist in his work, and his body image. He believed that his ostomy negatively affected his body. He find himself disgusting, and then he's also feared that his wife will look him differently in a negative way. That is his main concern for his symptoms. Patient is diagnosed with adenocarcinoma of rectum and colostomy was made. 6 months later, he returned with the complaint of intermittent abdomen pain and leakage of the chest through filter. Examination and some investigation done to overall condition of the patient's stoma and was admitted for colonoscopy and biopsy of stomal tissue. And this biopsy of stomal tissue, the result was benign. So for discussion point, number one is how will we teach the patient and relatives regarding the type. Let's answer the first point first. Anyone? How will we teach the patient and relatives regarding the diet?
Sister, can you arrange your microphone position? Your voice is not clear.
Hello?
Now it is audible.
Okay. Let's go to discussion point number one. How will we teach the patient and relatives regarding the diet? Any answer?
Sister, just read the two discussion points. Later we can discuss.
Okay. How will we teach the patient and relative regarding the diet? And number two is how to increase the patient's self-esteem regarding his body image. Thank you. That's all for my presentation.
Thank you so much for your presentation. Can you, it was slightly unclear for me. Arun, can you go back to the slide where she has mentioned self, s- the concerns, next.
Main concern.
Uh, Next slide. Yeah. So, what can you just share with us what exactly the patient told you about the self care, body image, relationship? What were the issues?
For his self-care concern, like he was embarrassed because as there was a leaking from the filter and he find it difficult to change by himself every time. So his wife needs to assist him. So like a man, as an Indian man, he was a bit embarrassed that he was always need to assist by his wife.
Sister, can you once again change your microphone position?
Hello.
Now it is audible.
Uh, Self-care concern. I repeat again. Uh, According to my patient, he feel embarrassed that he needs help. He needs assistance by his wife because in changing all his stomach bag and as he's having a leakage from the stomach, sometimes he needs to be assisted by his wife. This as a man, he feel a bit embarrassed here, and body image or self-esteem concern here. He uh he find himself very uh disgusting or dirty when there's a leakage from his stomach, and then in for relationship concern, he's afraid that his wife will look in a negative way. These are all his concerns.
Thank you. I just wanted to share the thing because so that everyone will understand what are the issues faced by your patient. Right? Okay. Can we come back to the last slide, Arun? So, anyone from the participants, can we just share your experience with the diet? Although we have heard everything in Swarup's presentation in detail, how to deal such issues, but I would like to hear from you. In your practice, what do you advise in terms of diet? Do you tell them to avoid things, or do you tell them to add a few dietary things from other participants? You can either type it in the chat or you can just share by unmuting so that we can all learn. Is there anything new that we can also learn from? Any specific food that you would like to tell them not to eat this, or yeah, soft and easily digestible? You want to avoid certain things, or you want to add specific things to the diet? Is there anything that you tell your patients in your place? Yes, avoid spicy food, fiber-rich diet. And what is your experience in when have you seen any difference when you change the diet? Have you seen any difference in terms of the bowel habits or the smell or the gas? Yeah, avoid gas producing, exactly. Cabbage, small amount but short interval. Yes. We have heard everything in Swarup's presentation, but still it's good to share your experience so that avoid fat-rich diet. And have you seen a market difference when you tell the dietary changes in terms of smell and other issues? Drink a lot of water, about 8 glasses. Yes. And how would you like to help this patient in terms of improving his self-esteem? What would you like to tell the patient and the family how to help them? Yes, keeping the stoma area clean. I'm sure that you all have learned how to, you might be already doing, but today it was much more clear how to clean the stoma area, what all materials to be used. If anyone has any doubt regarding the Karaya powder or where to buy it, Swarup, you can just type it in the chat box so that they can just, yes, counseling the patients and the family. I think the counseling part is the most difficult part because it's easy for us to tell, to accept this as a part of your body, but it is very difficult part for the patient as well as the family. And even with us, I don't know whether you have noticed, when you tell them to show the stoma, or when you do the general examination, they'll be very hesitant to show the stoma, especially when it has some fecal matter. They'll be very embarrassed to open and show and talk about it. And then you have to insist that it's okay, you want to see, you want to examine, then only they'll be ready to show you, right? And that's what my experience is. Anyone would want to unmute and talk so that I can hear some other voice than mine? Yeah, so there is the place where you can get the irrigation set, everything. It's typed in the chat session, Ostomy India. They will send you the bags wherever you are. You just they'll send by post or courier. And it's very difficult to talk about the sexual issues, but for young patients, they do face a lot of sexual issues, and they won't tell you upfront that I am having these kind of issues. But whenever we see patients with colostomy, and when once you establish the rapport, it's very important to ask about the sexual issues, because they won't come and tell you, even the partner won't come and tell you that these are the issues. But it's very important to talk about it. Once you start asking about the sexual issues, just one question, they'll bring out lot of issues that they are facing in their family. Karaya powder, I am not sure. Swarup, do you know whether it is available outside India? No, she's asking whether it is available in India only. Can it be? She's in Nepal, I guess. Someone
No,
from
madam, I'm
Nepal.
sorry. Because even people who, like, we also undergo some trainings here, 6 weeks course. So people come here and collect one bottle from here. So it is a product of India. Somewhere when you're just taking it a bit confidential, that's it. So, or else if sometimes, people even doesn't have the availability of that, we just tell them to use some lubricants, good lubricant like liquid paraffin, cleaning up with that, or just egg white can also be more helpful even as a binding layer. If that is not available, that is the only option we see.
Some of the places they give topical application which has zinc oxide, I guess. Have you seen? Do you think that is helpful? Usually prescribed by the surgeon itself.
Yes,
They come
yes.
with the zinc oxide
Yeah,
because it absorbs the I think
exactly. Yeah. So it is for the temporary colostomies, we do it in our hospitals too.
You want to talk about it a few sentences, like when to use, if it comes like some patients brings that and ask us what to do with this, how to apply for what.
Okay, so the application of the zinc oxide is every third to fourth day. So you may have to keep changing it. So when you just take pictures of that, that will be make sense when you start doing it, whether there is a big difference with that or not. And sometimes even some antifungal powders also make a crucial change in that with the zinc oxide, and some antifungal powders also can be helpful. Every third to fourth day, you may have to take a picture and see the difference, and do it more routinely till the time there is this excoriation has come down. That's all we can do. As it is available in our hospital for free of cost, we don't tell them to purchase anywhere, as we are just providing it for free.
Any other few last questions before we end the session? And from Swarup, what would you like to add on to this discussion? How will you teach regarding the diet and how to improve self-esteem? Everything
Yeah.
was there in your presentation, but just to
Okay.
conclude.
Just already I see a lot of our nurses have spoken about that. Maybe a bland food can be preferred more than that, and low fiber diet should be preferable. Banana, rice, apples, and toast. See some changes which, see, we are not looking into what is making them more comfortable, but what is tastier and what makes them more happier is what I feel like. Because frequently these aggravating factors or disaggravating factors will be more common in the situations. Sometimes well cooked warm foods and semi solid bland diet and low fiber diet is more helpful. Maybe about the second question, like how to cope up themselves in that situation, is social activities I see plays a major role in that. Every Saturday in our hospital, like we are been linked up with one of a government regional cancer hospital. We also have a research centers available there, so we learn more about the lymphedema, colostomy a lot, out of which we see every Saturday we call up all the patients with the stoma. So one to one they'll have an interaction and they just talk about themselves, their own issues, and what are the troubles I am facing. The day when they come to us, they might be a bit difficult for them, very hard to come and sit with us and spend some time. When they see such situations, lot of interactions, social activities happen there. People coming close together and trying to motivate them in a way that support groups and participation in that support groups make a lot of changes in them. So I feel maybe if this would be enveloped and encouraged to the patients and families, you can see a lot of changes in that. That's what I would like to say.
Yeah, that is very important. How much ever we say, uh, in the bottom, if it was me, I would think you don't know what I am going through because you don't have a bag. So when they see people who have these problems, and then they can discuss among themselves what they are going through, small tips also they can exchange. So self-support groups are really important, even in terms of lymphedema as well as in colostomy. They need a lot of support in that terms to see that it is okay to live with that, and what all things can be done in their own lives that we can change. But I think in a standalone palliative care centers, the number would be really small. That is one thing that I face, like we face. We don't have the number, and it will be scattered everywhere, so they can't come at one time and talk about it. But yeah, that is one of the important things that we can incorporate if you are working, especially in a cancer center.
So, yeah, good afternoon. Yeah, can I ask Dr. Swarup something?
Sure.
Actually, I work in a neonatal setup. So we do get babies with, the newborns with ileostomy sometimes because of the gut problem. So we face so much of skin irritation conditions. So how do we tackle that?
Yeah, the basic thing what even I have seen in neonates, a lot of patients with same kind of excoriations. So we do not apply carrier powder in that neonates to say, but cleaning up with the normal saline water, well, making it dry, open all the time, and try to add some adhesive cloths to that. It is more comfortable instead of cotton layers. That will be more easier for them. Less moisturizing in that particular area. That's what we do.
We tried with the Tegaderm stuff to stick on. Yeah, and sometime we tried with the hydrocolloid one also around the stoma.
So did that make any difference in this?
Yeah, the initial when we couldn't do anything, so much of excoriation. Then the excoriation was so, the area was so much was spread. So then we tried with the Vaseline and everything, the lot of Vaseline over that.
So in that age groups, generally we prefer only this petroleum jellies.
Yeah, yes.
As skin is very soft and gentle, we go for very smoothening agents. That's it. So we don't use carrier powder in that stage unless there is a lot of excoriations and the baby is crying a lot with pain. I see a lot of babies with what to say, some baby rashes, So
Yeah.
prolonged pressure of diapers usage, which leads to the rashes, and whole night the baby is screaming in pain just because of that. So maybe in that situations we go up applying that carrier powder, unless we go out with the light petroleum jelly.
We used to use the the petroleum.
That's great. That's great. That's a good thing.
Thank you. Yeah.
Yes, ma'am. Thank you.
Thank you, Swarup, for the excellent session today.
Thank you, madam.
I always feel this is a really, really important session, and we should start teaching doctors also the same session.
Thank you, madam. It was wonderful talking to you and all your group, and special thanks for the Pallium India for the support. Yeah, thank you so much.
Thank you all the participants and sister who did the presentation. And before logging out, kindly give the feedback. The link is in the chat session. So give your feedback, and then we can meet on Thursday, right, Arun?
Yes, ma'am.
Thank you so much, everyone.
Monday, ma'am.
Okay.
Thank you, Sri, ma'am. Thank you, Swarup, sir. And next week we